Instructions for successful plastic surgery. Surgery-specific instructions. During the first week after your brow lift, facelift, neck lift, eyelid surgery, or rhinoplasty, please make sure to keep your back elevated over 2 to 3 pillows at all times. Do not lie flat. This will reduce swelling in your face. Keep a light ice pack on the surgical site for the first 2 to 3 days. Icing will also reduce pain and swelling. Apply bacitracin ointment to the facial incisions and bacitracin ophthalmic ointment to the eyelid incisions every 6 hours. If you're having a rhinoplasty, please make sure to keep the cast on your nose at all times. Breast reduction. During the first week after your breast surgery, try to sleep on your back over 2 to 3 pillows or on your sides. It's very common for the two breasts to heal differently, so don't be alarmed. One may swell more, one may feel more uncomfortable, or the shape may differ initially. After complete healing, they should look remarkably similar and natural. You may experience a burning sensation in your nipples for a couple of weeks after surgery, but this will subside as well. Regeneration of the sensory nerves is accompanied by tingling, burning, or shooting pains. As the nerves regenerate, the nipples commonly become hypersensitive. This will subside with time. You may find that gentle massaging will help. If you develop any changes in the color of your nipple areola, such as a dusky or bluish color, please inform our office immediately. Arm lift. For the first 2 weeks following your arm lift, please keep your arms elevated on 2 to 3 pillows. The arms should be higher than the heart level. If you develop swelling in your hands, unwrap the ace bandage for a few hours or overnight while keeping your arms elevated. Reapply the ace bandages later, but always make sure to start at the wrist and work your way up. Tummy tuck. The morning after your surgery, please make sure to clean your belly button with a gauze. Once that is done, take a picture with flash of your navel and email it to the office. During the first 2 weeks after your tummy tuck, try to sleep on your back and sides. Reduce the tension on your tight abdominal incision by having many pillows both behind your back and under your knees. This ensures that the tension on your incision line is minimized, which will reduce pain, and it will result in a thinner scar during the initial healing process. It is ideal if you are in a recliner chair at all times. You won't be able to stand fully upright for 14 days or more after a tummy tuck. Even though you can't stand straight, it is still important to start walking as soon as possible, usually the evening of surgery. The best way to reduce the chance of a blood clot in the legs is to walk. You can use a walker and should have assistance when walking. Inner thigh lift. During the first week after your inner or spiral thigh lift, please keep pillows under your knees while sleeping flat or sitting upside. This ensures that the tension on your incision line is minimized, reducing pain and resulting in a thinner scar during the initial healing process. Keep your legs elevated to reduce swelling. Make sure to keep the inner thigh and groin crease dry and clean at all times. Wipe the incision on a daily basis with sodium chloride solution and gauze. Let the incisions air dry. Then place Kerlix gauze into each groin crease to keep the incision dry. Change 3 times per day. Lower body lift. For the first 3 to 4 weeks after surgery, you should be sitting and sleeping in a recliner chair with your feet up to ensure you're at a 45 to 90 degree angle at all times. Attempt to sleep on your back and sides. Reduce the tension on your abdominal incision by having pillows behind your back and under your knees. This ensures that the tension on your incision line is minimized, reducing pain and resulting in a thinner scar during the initial healing process. Please also read the tummy tuck and liposuction instructions. And make sure your wound vac is on at all times and the wound vac dressing is compressed. Liposuction. During the first week following your liposuction procedure, Try to sleep on areas that have not been liposuctioned to reduce pain and discomfort. For the first 4 to 6 weeks, avoid wearing clothing that is too tight, as they can leave a band of demarcation on your skin and negatively affect your result. Do not be alarmed when blood-tinged fluid oozes from the liposuction sites. This is very normal and usually stops within the first few days. You should cover your chair or bed to avoid any staining. There will be bruising in areas that are liposuctioned and in areas that are adjacent to them. For example, you may notice bruising in genitalia after liposuction of the abdomen. This is because blood travels downward due to gravity. Sun tanning immediately after surgery can cause these bruises to become permanent skin stains. So please stay away from the sun. Brazilian butt lift. Fat transfer to the buttocks. Read the liposuction instructions in addition to these instructions. Brazilian butt lift is included in most lower body lifts. Following a Brazilian butt lift, ideally try to lie or sleep on your sides or abdomen. Stay away from sitting directly on your buttocks, especially on hard surfaces. Use a donut pillow for 4 weeks until the injected fat cells become vascularized and permanent. Mild discomfort and tightness in the buttocks is very common for the first week or 2 after surgery. After this period, the tightness will begin to subside and the pain will decrease significantly as well. If you have a lower back drain, care for it religiously to heal faster. Strip the drains every 3 hours and keep the drain site clean with alcohol. Do not let the drain get pulled out. Emergencies. Some discomfort is expected following your surgery. However, please be sure to tell us if there's an increase in swelling, pain, redness, drainage, or bleeding in the surgical area. If you develop a temperature more than 100.4, if you have dizziness, vomiting, or a general ill feeling. If you develop calf, foot, or ankle pain with swelling, as this is a sign of a blood clot that can travel to your lungs and be life-threatening. Seek immediate medical attention if you're experiencing shortness of breath, chest pains, or unusual heartbeats. Should any of these complications occur, you may require hospitalization and some additional treatment. Thank you for completing this educational presentation. If you have any other questions, please note them for your in-office preoperative appointment.